Thank you for choosing Orthopedic Associates of Muskegon and one of our partner facilities, Trinity Health or Muskegon Surgery Center, for your total joint surgery. Together, we strive to make your surgical journey a positive experience. This video will provide you with information about what you need to prepare for surgery, what to expect at the time of surgery, and following surgery. Please watch this video along with your chosen coach so they'll know how to best support you through this process. The total joint book you receive from our office supplements the information in this video, but it is important that you watch this video to the end. Also, read everything in your book and use it as a reference before and after your surgery. If you have any questions along the way or need clarification, please make notes and ask a member of your healthcare team. We are happy to address your concerns and appreciate the opportunity to do that before your surgery. You'll receive surveys by email from OAM prior to surgery, 3 months after surgery, and 1 year after surgery. It's very important that you complete these surveys to help us understand your progress and help us determine where we can make improvements in the surgical process.
If you haven't done so already, you'll need to choose a friend or family member to be your coach. This person will be instrumental in the success of your surgical journey. They'll need to stay with you for at least a few days after surgery, and possibly longer if you continue to need help at home. It's very rare that anyone goes to a nursing home or rehabilitation facility after total joint surgery. So having someone stay with you the first few days after surgery will ensure you have all the help you need. Most total joint surgeries are outpatient, and you can anticipate going home the same day. If your surgery requires an overnight stay, our goal is for you to be able to be discharged by 11 a.m. the following morning. So please make sure your driver is available. Your coach may also need to help you with any necessary paperwork before surgery. You should verify your coverage with your insurance company ahead of time, and you may need help to fill out FMLA or short-term disability forms required by your employer prior to surgery. Here are some things you'll need to do before surgery to make sure your living space is safe when you get home. Grocery shop, cook, and freeze meals ahead of time. Make plans for child care, elder care, or pet care as needed. Prepare your bathroom so it can accommodate a walker or a raised toilet seat if needed. Remove any cords and throw rugs that are in your walkway to keep the area free from tripping hazards. Move frequently used items off your top shelves to an area that is easy to reach. Install handrails where needed next to steps or stairs. Place night lights to light up walkways for nighttime bathroom trips. And make plans for someone to help you with your household chores such as laundry and lawn care.
There are also many things you can do before surgery to help your recovery go more smoothly. If you're a smoker, stop. This includes tobacco, e-cigarettes, and vaping. Nicotine leads to poor healing and can increase your risk for infection. It's important to quit smoking as soon as possible prior to surgery. As with any surgery, there is a risk of blood loss. Be sure to eat a healthy, iron-rich diet to help in your recovery. Obesity will increase your surgical risks and prolong your recovery. Healthy weight is important to reduce risks and improve your surgical outcome. If you're diabetic, it's very important to make sure your blood sugar is well under control. If your hemoglobin A1C is greater than 8, your surgery will be delayed. Diabetes can make it difficult for your body to heal quickly and increases your risk for infection. If your blood sugar is controlled before, during, and after surgery, you reduce your risk for complications. If you're currently taking narcotic pain medications, it's important to gradually decrease the amount you're taking prior to surgery. Taking narcotics before surgery can make your pain control more challenging after the surgery and may increase your risk for discomfort. Begin the exercises in your total joint book immediately. The stronger you are before surgery, the easier your recovery will be. Be sure to do the exercises on both legs, as this will help increase your strength for surgery. It's also important to perform arm exercises to give you strength to push yourself up to stand. Finally, make sure you schedule and attend pre-surgical appointments. These may include blood work, a visit to your doctor or the SOS clinic, a visit to the cardiologist, an EKG, and a visit to your dentist. However, it is important to note that you should avoid any dental appointments that are not emergent 6 weeks prior or 3 months after surgery.
You will be given surgical wipes ahead of time to prevent infection. It's very important to follow instructions and complete the skin cleansing process prior to your surgery. You will also receive phone calls from the surgery facility. These calls will review your medical history, current medications, and what medications you need to stop prior to surgery. Your surgeon may have you stop certain of these medications prior to surgery, and we'll discuss that with you. You may also refer to your total joint book for the complete list of medications and over-the-counter medications that you need to stop prior to surgery. If you have a question about your medications, please contact our office. The surgery facility will also call you the day prior to surgery to let you know the time of your procedure, when you should arrive, and when you need to stop eating and drinking. The day before surgery is an important day. Make sure your home preparations are complete. This includes washing your sheets and towels so that they are clean when you return home. Make sure you're packed for your surgery. Important items to include are your total joint book to keep your education all in one place. Please also bring your list of current medications with you, but do not bring the medications themselves unless you are told to do so. You will want to wear loose clothing, comfortable clothing to the surgery facility. Supportive shoes will help you as you walk with physical therapy afterward. Please do not bring sandals, slippers, or flip-flops, as those can increase your risk for falling and injuring yourself. If you have your walker, personalize it with a name tag and plan to bring it to the facility with you. Also bring a phone charger if you plan to utilize a cell phone. Your family can leave those items in your car until your surgery is complete and you are out of recovery, and then they can bring those in. And lastly, leave all valuables at home.
On the day of surgery, you'll check into registration at the scheduled arrival time. Then you'll be directed to a room to prepare for surgery where you'll meet with the anesthesiologist and your surgeon. You'll receive a nasal swab and another set of skin cleansing wipes to help prevent infection. An IV will be started. Once you're prepped, we'll limit the number of family members who can stay with you until you go to surgery. Your family will be able to wait in the waiting area until your surgery is complete. When you wake up from surgery, you will be in the recovery area for at least an hour, and a nurse will check on your vitals regularly. You'll be wearing oxygen, and you'll have compression devices on your legs to help prevent blood clots and maintain circulation. Your family will be able to see you once you are out of the recovery area. Pain management is important to us, but you should expect some pain after surgery, even though you may have a nerve block in place. Our goal is to make sure your pain level is tolerable and that you are not too sedated. Moving will help decrease pain, and you'll be up and walking short distances soon after surgery. Moving is very important because we don't want your joints to become painful from lying in bed too long. Short, frequent walks will help control your pain. Please use your call light to ask for help when you need to get out of bed. Positioning may also help with pain control. Talk to the staff if you are uncomfortable, and they can help reposition you to improve your comfort level.
You'll get up to walk after surgery using a walker. A nurse may help you get out of bed before you see a physical therapist. When physical therapy arrives, they will teach you how to get in and out of bed safely, how to use stairs, how to sit and get up from a chair and toilet, and how to use your walker. They'll also fit your walker to you if needed. Your risk of falling is highest the first few days after surgery, so you need to be comfortable using an assistive device until it is safe to progress from a walker to a cane and eventually no device at all. Your physical therapist will show you exercises that are key to your success early on. Remember, it's important to perform these regularly throughout the day to improve your range of motion. Once you return home, walking regularly is also important to improve blood flow, reduce the risk of blood clots, and promote healing. If your surgeon recommends physical therapy, make sure to schedule your first appointment right away so you start your PT on time. Anesthesia, pain medications, and being less active increase certain risk factors, but there are steps you can take to lower your risk. For example, you'll be asked to perform deep breathing to prevent lung infections such as pneumonia. We'll teach you how to use an incentive spirometer, or Inspirex, which you will take home and use for 2 weeks after surgery. You should also sit up in a chair when you eat meals to help expand your lungs. If you have compression wraps, be sure to wear them on your legs when you're lying in bed or sitting down, and do regular ankle pumps for several weeks after surgery to prevent blood clots. Constipation can be another concern, but we'll provide stool softeners and a list of other medications you can take to keep your digestive system moving. Frequent short walks and drinking lots of water may help too.
Most surgical incisions have a mesh covering or steri-strips that need to remain in place until we see you at your first follow-up appointment 10 to 14 days after surgery. You may shower, but it's important not to scrub the incision or immerse it in water until your surgeon tells you it's healed. Don't put lotion or any type of ointment on your incision unless your surgeon tells you it's okay. Keep animals away from your incision. We know pets are family, but while you're healing, it's important that your pets do not sleep with you and your incision is covered if they are lying nearby. Pets can sense you're not feeling well, and they'll want to be close to you, but this could risk infection or injury if they were to jump on your surgical area. Always use a clean towel and washcloth while you're healing, and do not touch or allow anyone else to touch your incision. Be sure to wash your hands and use hand sanitizer often. It isn't unusual to see some blistering around the incision as it heals. If you have concerns about your incision or questions about wound care, we encourage you to call your surgeon's office or visit one of our urgent care locations in either Grand Haven or Muskegon. When you're discharged, we'll give you a short-term prescription for pain medication. It's important to take your medications routinely the first few days after surgery to stay ahead of the pain. You'll also receive instructions on what medications you can resume after your surgery.
Please know that surgery is not a magic cure, and it will require hard work throughout your recovery. Success starts with a positive attitude, so set goals for yourself and focus on what you can control. You will have pain after surgery, and your first week following surgery may be the most painful. Our goal is to decrease your pain to a level that allows you to move and participate in activities that will help you recover more quickly. There are many ways to keep your pain tolerable. Take your pain medication about 40 minutes before physical therapy. Cold therapy is a great way to reduce swelling, which is often a leading cause of pain. By icing regularly and elevating, you may be able to reduce your pain. Take frequent short walks and gradually increase the distance each time. But be sure to listen to your body and don't overdo it. Remember, the best progress is made by walking and doing your exercises consistently. You will not be able to drive for at least 4 weeks after surgery, and you'll need rides to doctor appointments and physical therapy. If your coach cannot drive you to your appointments, you'll need to make other arrangements. We appreciate you taking time to watch this video. It's important that you follow the instructions both in this video and in your total joint book. We promise to do everything we can to help you have the best possible outcome, but the rest is up to you. Your dedication to the instructions and exercises will help make your surgery successful. Thank you again for choosing Orthopaedic Associates of Muskegon for your total joint surgery. Together with our excellent partner facilities, Trinity Health and Muskegon Surgery Center, we are here to meet all your needs. As always, we want to continue to be your healthcare partner for life.